Now, the FDA has also approved the first at-home rapid coronavirus test. The test was created by the company Lucira, which is a California manufacturer, and it takes about 30 minutes. It allows you to do the nasal swab yourself, then put the sample in a vial that plugs into a portable device. It then reads the results, either positive or negative. The test right now requires a prescription. Now, we're seeing more rapid testing across the country and here in our state. But how trustworthy are these tests? Allison's back with us now. Allison, what'd you find out?
Well, I talked with Dr. Thomas Unnasch at USF Health. He's a distinguished university professor and co-director of the Center for Global Health Infectious Disease Research. He says there are two things you look at when you look at a test: sensitivity and specificity. So let me break that down for you first. With sensitivity, if you run the test on 10 people who are known to be infected with COVID-19, how many of those will actually test positive? If you have a test with 90% sensitivity, 9 out of the 10 people who are positive will get a positive result in the test. One person will be a false negative. So the test says that they don't have the infection when they actually do have it. Now, with specificity, if you have 10 people who don't have the infection and you give them the test and 9 of them test negative and 1 test positive, your specificity is about 90%. So Dr. Unnasch says the rapid test specificity is really good. The sensitivity is not great. So this is useful in a population sense, that you get an idea of how many people are infected.
If we run these and we're picking up 70% of the people who are infectious, even if they're not asymptomatic, or even if they're asymptomatic, and they go and they quarantine themselves, now we've reduced the level of transmission by 70%. And if we do that in a population as a whole, it's going to die out pretty quickly. Even if we're, have a leaky system and we're still getting missing 3 out of every 10 people who are really infected.
So if you test negative, he says it doesn't really give you any real confidence that you're not infected. And it's just a snapshot in time. Just because you get a negative result doesn't mean that you won't go out and get exposed and then test positive. So what do we do about all of this, right? Well, he says we have to fall back on what we've been doing. Wear masks and social distance for as long as it takes, even when it's tough during these holidays like it's going to be. And in his words, with a vaccine on the way, quote, "Put your heads down and slog along for that last half mile, and then it's all going to be gone."